Audio Jungle. Audio Jungle.
Welcome to our channel. Today we're diving deep into a topic that affects millions of people worldwide: anxiety and depression. These are serious mental health conditions that can impact every aspect of your life, from your relationships to your work, but too often they're misunderstood, stigmatized and left untreated. That's why we're here to break it down together. We'll explore the differences and similarities between anxiety and depression, delve into the causes, and discuss how to recognize the symptoms. Whether you're personally struggling or you know someone who is, this video will provide you with valuable information and resources to help navigate these complex conditions. Let's get started. Let's start by understanding what anxiety and depression actually are. Anxiety is your body's natural response to stress. Think of it like your internal alarm system going off. Everyone feels anxious sometimes, like before a big presentation or a first date. It's when that feeling becomes persistent, excessive, and starts interfering with your daily life that it becomes a disorder. Depression, on the other hand, is a more persistent feeling of sadness, hopelessness, and loss of interest in things you used to enjoy. It's more than just feeling down for a day or two. It's a serious medical condition that affects your mood, thoughts, and behavior. While they are distinct conditions, anxiety and depression often go hand in hand. It's like they're two sides of the same coin. Someone struggling with anxiety might constantly worry about the future, while someone with depression might dwell on past regrets. Now, what causes anxiety and depression? Well, it's rarely just one thing. Imagine a perfect storm brewing. It's a combination of factors. Genetics can play a role, meaning if someone in your family has a history of these conditions, you might be more susceptible. Then there are environmental factors like chronic stress, trauma, or a major life change. Think job loss, the death of a loved one, or even something positive like getting married. These events can trigger or worsen existing conditions. And we can't forget about the brain itself. Chemical imbalances in the brain, particularly with neurotransmitters like serotonin and dopamine, which regulate mood, can also contribute to anxiety and depression. So how can you recognize if you or someone you know might be struggling with anxiety or depression? The symptoms can vary from person to person, but there are some common signs to watch out for. With anxiety, you might experience physical symptoms like a racing heart, sweating, trembling, or shortness of breath. Mentally, you might feel restless, irritable, have difficulty concentrating, or experience panic attacks. Depression, on the other hand, might manifest as persistent sadness, loss of interest in activities you used to enjoy, changes in sleep or appetite, fatigue, feelings of worthlessness, or even thoughts of suicide. It's important to remember, if you're experiencing any of these symptoms, don't brush them off. It's essential to reach out for help. There are so many myths surrounding anxiety and depression, and it's time to debunk them. One common misconception is that these conditions are a sign of weakness. That couldn't be further from the truth. They're medical conditions, just like heart disease or diabetes, and they deserve the same level of attention and care. Another myth is that people with anxiety or depression should just snap out of it. If it were that simple, don't you think they would have done it already? These conditions require professional help and support, not judgment or dismissal. And finally, some people believe that medication is the only solution. While medication can be helpful for some, it's not a one-size-fits-all approach. Therapy, lifestyle changes, and support groups can also be incredibly effective. The good news is that anxiety and depression are treatable conditions. The first and most important step is acknowledging that you need help and reaching out to a healthcare professional. They can provide a proper diagnosis and recommend a personalized treatment plan. Therapy, particularly cognitive behavioral therapy, can be incredibly effective in teaching you coping mechanisms to manage anxiety and negative thought patterns associated with depression. Medication like antidepressants or anti-anxiety medications can also be helpful in regulating brain chemistry and alleviating symptoms. However, it's crucial to work closely with your doctor to find the right medication and dosage for you. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. Remember, it's okay to seek help and talk about mental health. You are not alone in this journey. Anxiety and depression are incredibly common and treatable conditions. By understanding the symptoms, causes, and treatment options, we can break down the stigma and empower ourselves and our loved ones to seek the help they deserve. Remember, your mental health matters. Take care of yourselves and each other.